Good win.
Okay, so let's do the over and under technique. That's where you come side of the table, one hand above, one hand below, and you mobilize the neck by moving the head with your top hand. You can get a full range of motion check to see the quality of the movement, but you could also play with disturbing her nervous system habits by going back and forth in different increments of length. And the feeling that I get from her is she's helping but then not able to help because I keep changing the direction. And my fingers are near the lamina groove. They're in the muscles. When I find a tight spot, I might do some micro moving or some ischemic pressure holding. The other technique that we did is the wave. But be sure to go backwards as well. So you bring the fingers up towards the occiput, but then you go backwards in reversal. It's a great way to assess the neck. And to get the sternocleidomastoid, I like to cup the head in my hand, turn the head about 45 degrees, sometimes more, and use a pincer grab. Move in, and then pull the fingers out, and you should be on the two heads of the sternocleidomastoid. If you have a light, loose grip, you're just on one head, and you can feel that. You want to go back in deeper and come out just a little bit and do a pincer grab and micro move back and forth. Move up and down from the mastoid process all the way down to the lower attachments on the clavicle and the sternum. Micro move or ischemic pressure holding techniques. And then to do a nice pin and stretch on the scalenes like we did before, we find our troublesome scalene spot. And then I ask her, when you inhale, to tilt your ear towards my hand. And exhale it, stretch to the other side. Inhale, come back and tilt. Exhale, go back to the other side. All the while, my finger's still on the scalene spot. Inhale, come back. Exhale, relax. I'm pinning it and stretching it. The other stretch is where you're not pinning the muscle. Inhale, tilt your ear towards my hand. Exhale, and relax. Inhale, shrug your shoulder. Exhale, relax. Now inhale, shrug and tilt at the same time. There you go. Exhale, relax. So you do tense and relax 3 reps, and on the 3rd rep you hold it for 20 or 30 seconds. And since we're trying to release these trigger points, we don't want to do 100% stretch, so I find her end point and I come out of it a little bit.